Well, hi, everybody. Glad to be here today. My name is Renee Schulte, and we're going to be talking a little bit about self-care. But as we get started, I want you to take a minute and get centered right where you are. So just take a moment and take a couple of deep breaths with me. We're going to do the box, if you know the box breathing technique. And if you don't, just follow along. We're going to breathe in for 4. We're going to hold across for 4, breathe out for 4, and then across for 4 to make a square. Everybody ready? We're going to do it 2 times. So count with me for 4. Hold. And release. And hold. All right, did you get it? We're going to do it one more time. Let's do another box for 4. Let's go start with enter, going in. Hold. Release. And hold. Welcome to Self-Care with COVID Recovery Iowa. We are so glad you're here. We're just going to talk about a real short time, about 15 minutes, about what you can do for self-care today. And if you're a mental health professional just like me, you know that we know what we're supposed to be doing in self-care, but we don't always take time to do it. And that can cause problems for us and for people around us. And so the topic we're going to talk about today is sleep. Because without sleep, you actually don't really have a good self-care routine. Sleep is a key ingredient, not because you're grouchy when you don't get sleep, and not because research tells you that you have to sleep, but because you're 3 times more likely to get sick when you don't get a good night's sleep. I don't know if you know this, but research shows that if you're a person that gets chronically under 7 hours of sleep a night, and that's actually a sleep, not like getting up all night long, but actually 7 hours of sleep, you are 3 times more likely to get sick. Any kind of sick, catching a cold, the flu, COVID, all of it. And as you're a health professional, just like me, we're out and about working with people. We're the essential workers that go to work every day. And we're the people that are around probably the most germs, especially if you're working with small people. They bring all the germs home, right? And so you don't need to get sick. So we're going to talk about sleep and some of the things that are really important just to think about. And we're only going to talk about 2 or 3 easy tips for you. And then at the end, I'm going to have something I can offer you for free, and we'll put it in the comments, called the sleep routine, that if you would like to get more information and learn a little bit more how you can have a better sleep routine, we'll get that at the end. But if you're ready, we're going to talk about sleep for just a minute. So first of all, when you're thinking about sleep, sleep requires setting boundaries. Now, I know that might think a little different for people because they're like, boundaries? What are you talking about? But to get the right amount of sleep each night, you have to have boundaries, like at the beginning of your night, like what time I'm going to bed, and again, what time I'm going to get up. And you have to have a little bit of boundaries in your life about setting a schedule and a routine. Because if you don't set the same schedule each night to go to bed, how do you know how many hours of sleep you're going to get? And if you have to get up the next morning early for a meeting or something and you don't adjust at the beginning, you know for sure you can't get enough hours of sleep. And so you have to think about setting boundaries and a schedule for yourself in order to know that you're going to even have the possibility of getting enough hours. Because if you're not even in bed at 8 hours, you're not getting 8 hours of sleep. Now, there's more to it, right? We all know that once you lay in bed, that doesn't mean you fall asleep, and those are different issues. But first, to give yourself a fighting chance, you actually have to go to bed. And some of us, we don't really do that very well. We stay up, we talk to our kids, or we get super excited because we put our kids to bed at 8 o'clock and now we have me time. And that's like, oh my gosh, so exciting. And so you want to stay up because you're like, you want to read, you want to watch TV, you want to do this, you want to do that. But then that actually encroaches on your sleep time. And then back into the next morning, we're grouchy because we didn't get the sleep we need, right? And so the first piece of this is thinking about that routine, like getting yourself to bed on time and then getting yourself up on time. Your body does better when you have a set plan. Little kids do. You know that in a time change, they wake up at 6 a.m., whether the time changed or not. Their body just does it. Well, I'm here to tell you, you can too. I can. I haven't used an alarm clock for years. And it's because I took time to teach myself how to actually sleep. And that's part of that sleep routine I was telling you about. You can learn this too. And I'd be happy to help you do that when we talk about it more. But a second boundary to think about sleep is actually what you eat and drink during the day. And you're going to be like, what? How does eating and drinking have anything to do with my sleep? It has everything to do with sleep. So think about caffeine, nicotine, and alcohol. Three big pieces to a good night's sleep. So some people are more sensitive to caffeine and nicotine. Those are stimulants. And those, you know what those are, right? We wake up in the morning, grab that cup of coffee, wakes us up for the day, and that's awesome. But what's not awesome is that cup of coffee right before bed and then trying to sleep. Not awesome. And so you've got to think about, how much caffeine do I need? Do I need caffeine at all? And if you're a smoker, nicotine does the same thing. Nicotine doesn't help go to sleep. So if you're a smoker, is there times a day or whatever? What should I do? And everybody's different. So it's going to have to work for you. I know for me, if I drink any caffeine past like 4 o'clock in the afternoon, I'm up 1 hour later at night, almost guaranteed. And if I forgot to count how much I drank during the day, that messes all that up too. My husband, on the other hand, I don't think he sleeps well most of the time. He can drink, like he used to drink Mountain Dew. He could probably do that before bed and fall asleep. Now he's not getting a good quality sleep. So he's not getting that reparative, rejuvenative sleep that you need for actually feeling better, but he actually is sleeping. So I can't really fight with him as well about that. But for most of us, especially women, caffeine and nicotine are a really big thing. Now, the third one, alcohol. I know right now in Iowa, the trends are going up for the amount of alcohol sales. And the group of women actually are drinking more. In our studies are showing that it's women, middle-aged women, and we're drinking wine, more wine, 1 wine, 2 wine, 3 a night. We are doing more. And I know we think that's helpful for relaxation. It helps me go to sleep. But that's not what alcohol does. Alcohol relaxes you. You might fall asleep faster, but 3 to 4 hours later, when it metabolizes in your body, you wake right awake up. Your body starts, you have heart palpitations, you might sweat, you might get night sweats. It kind of feels like menopause. And if you haven't been through menopause yet, lucky for you. But when you get there, it feels a whole lot like that just by drinking alcohol at night. So if you're a person that likes to have a happy hour or whatever, move it up into your evening. So early evening, right after work, or maybe even like a lunch on a Saturday, that won't interrupt your sleep as it would as if it's late at night.
And I got to add this in here, Renee, because,
please.
Because I know the caffeine thing. I know it. I do know it. But I did it this week. I didn't finish my coffee in the morning. Yeah. And I got home after picking up my kids at 4 o'clock, and there was that cup of coffee. I reheated it, drank it, because I thought, well, I didn't get my full dose today. Totally didn't sleep well. So I know it, and I appreciate the reminder.
It's the worst. And you think about it and you're like, well, that can't possibly be. Like if I'm working, not paying attention, for me, it's like 4 o'clock, 5 o'clock in the afternoon. And that same thing, I might have mine sitting there. But if I drink it and I'm like, well, I kind of want iced tea for dinner, I'm just up. And so, and then I'm laying in bed at night thinking, okay, what did I do wrong today? Right. And that's definitely not helpful for sleeping. It's like, my brain doesn't need to be thinking through, well, did you do this? Did you do that? And most of the time I've done something that has made me want to stay up at night. Now, there's going to be other people in this call that maybe just changing some of these things really isn't going to fix this, right? You may have other issues going on in life. So let me kind of give you an overview of when we might actually want to seek help, because there's specialists that work with sleep. And let me tell you, there's some really great people out there. And we, as helping professionals, in case you forgot, we are not great at asking for help sometimes. We help others, but we don't think about helping ourselves. But in the sleep department, really bad things can happen to our bodies physically, emotionally, and even spiritually if we don't get sleep. And so we need to start thinking about, maybe I need more. Maybe I don't need, this isn't just enough. So some of the things that can really impact your sleep apnea. And so some people think, well, I don't snore, so I don't have sleep apnea, but you can have different types of sleep apnea. There's actually apnea that actually occurs in your brain, where your brain shuts off your ability to sleep. So you may gasp at night, but you may not actually snore, but it's your brain that's doing that. And there's medications to help correct it. So if you're a person that wakes up and you just feel super groggy and tired, like you're never actually sleeping, or it could be like restless leg syndrome. And you wake up in the morning and you feel like you ran a marathon and you're laying in bed. You're like, why am I so tired? Why do my legs hurt so much? You might have something like restless leg syndrome where your body just keeps moving at night. So it's not restoring. it's continuing to go. Or you could have something like perimenopause, menopause with hormonal issues. Now, hormonal issues is actually my forte of disaster. I have done this so wrong. So my hormones, for all sorts of reasons, have been out of whack for a very long time, most of my life. And so I've had doctors involved, and hormone replacement therapy has been very helpful. But this last year I had a milestone birthday and everything went out of whack. So I started waking up at 2 o'clock in the morning, just laying there. And I'm like wide awake. And I'm thinking there's no good reason to be awake. I checked my caffeine intake. I thought about food I ate. I thought about all these things, and I'm still awake. And in that case, you actually have to talk to a doctor that can actually help you figure out what's going on. And right now during COVID, our cortisol cycle, so cortisol that's related to stress. So the pattern of what cortisol should look like is it should be high in the morning and kind of decrease and go down before bed at night. That's what it should look like. But when you're in chronic stress or during COVID, it shoots up and it stays high. And it might crash at night, but then it pops back up in the middle of the night. And so you wake up with that heart palpitation and you can't sleep. And so you may have to track that cortisol to see if you need the help that you might need to sleep.
And when you say during COVID, you don't mean somebody that has COVID, you mean
because
we're in a pandemic.
The pandemic.
Yes.
There is actually, though, a new one out that I don't know as much about called COVID insomnia for people who've had COVID. And there's some lingering effects for some people who've had COVID, that there's some insomnia type characteristics coming with that. And so that is not just pre-pandemic related, that's actually COVID related. So it's kind of a little of both. So again, in any of those kind of cases, a medical doctor would be the first stop. So talk to your primary care doc and say, this is what's happening. And what they're going to ask you is, do you have trouble falling asleep, staying asleep, or getting up in the morning? And those are 3 different things that they can check in your system to see. But asking for help really is the 3rd tip of getting a good night's sleep, because sometimes we need more help than we think, and it's not right. So we a lot of times think, especially those of us that hit like that menopause age, we think, oh, just not getting sleep is just part of the deal. It's just the way it is, but it doesn't have to be. And your body needs that sleep.
I'm thinking about, menopause, and I think women, but, men can have hormonal changes too, correct?
They do. So as their testosterone drops, they have challenges with their cortisol as well. And so it's not just about women per se. Men can struggle as well, and your hormones as they fluctuate. So during COVID being home, during the pandemic, our stress has changed, and the stress has impacted all those other hormones. And the first thing to get really messed up is sleep. So if you've had a really rough year of sleep, it could be the anxiety of the pandemic, but it could also be your hormones are out of whack due to what's going on around you. And so it's just worth having a conversation with your doctor, because here's what happens if you don't take care of sleep. Besides being grouchy, you can actually gain weight. You can actually have more challenges with inflammation and more likely to get chronic diseases through that inflammation pathway. So if you are a person that's not getting good sleep, your body starts kind of putting on fluid and inflammation, and then all sorts of things. So you can become pre-diabetic, rheumatoid arthritis, different things like that. And so you really, really, really don't want that chronic disease path. So in order to kind of intercept that, we need to just check out with our doctor and say, hey, for the last so many months, I'm up at whatever time it is, and I stay awake this long. And then they'll start going down that path to kind of check some boxes to make sure that things are okay. But if you're not in that category, working on things like setting boundaries at night, like we talked about the first tip, or controlling your caffeine, nicotine, and alcohol can make a huge difference in how well you sleep. So Mandy, do you have any questions for us?
Well, I wonder if anybody that's watching, it looks like we have a handful that are watching live. If anybody has any questions, you can put them in the comments and I can read those to Renee. Let me think if I have any questions. Well, you were talking about alcohol sales being increased. So we should watch our alcohol intake. Caffeine, I just think with the lack of routine during the pandemic, maybe this has all been a little bit more difficult because of this, like, why am I drinking my coffee at 4 o'clock? I shouldn't be doing that.
That's very true. So because we've got off schedule, off routine, right? So maybe you were a person that got up every day because you had to be at work, I think of my husband. He had to be up at work and he had to be at his desk at 8 o'clock every morning. And that was across town. It was probably 30 minutes, like a really kind of a commute to and from the office, that kind of thing. Well, once pandemic hits, he works, like probably 25 steps from his bedroom to the office. So he can seriously get out of bed at, 7:55 is still a lot of time to get, 25 steps across to the office. And so, you just start kind of letting things go, right? You kind of let it slide. It's like, well, I can sleep a little later because I don't have to drive somewhere. And so what that has done then is really kind of impact what would be a normal rhythm for you of sleep has been interrupted due to the pandemic. And that's a great example. And so then you might feel more exhausted. And who wouldn't? I mean, last year at spring break, we thought kids were going back to school, right? And then they stayed home. And if you're a parent of small ones, how did you not feel more stressed out and more tired and more exhausted? So you might have started picking up more caffeine, right? It's an easy go-to. Your 1 cup became 2. And if you're home, you could make more. So it's like, that's an easy habit to get into where you might not have meant to, but and so you don't beat yourself up for the choices we've made. It's been a very hard year, but just think about, okay, and now that we're trying to pull out of the pandemic, and if some things aren't quite right, there's some options for us to get help, and looking at, okay, what kind of habits did I pick up that may not be the best? What can I do to help myself get some sleep?
You offer more trainings, more than just this 15-minute little tidbit that we're doing today, more extensive training. And we'll put some of that information in the comments, but if you want to say anything, speak to that, feel free.
Sure. So I have an entire program that I do called the ABCs of self-care. And we talk about boundaries, that's your B, but we also talk about activities and what we need to do to be active in our life. And then the connections that we need to really get good quality self-care, because self-care is kind of more like a 3-legged stool. But today we just talked really about the sleep, because that is a kind of a key linchpin to the whole thing working out, because you're not going to be really active if you don't sleep well. And you're grouchy around everybody else who's not really going to want to connect with you if you're not sleeping good. So we started out here. I know we have another one of these Facebook Lives coming up in a little bit. We'll do another piece, but if people want more information, we will definitely put that in the chat.
I'm a children's therapist, and what strikes me is that we work so hard at getting our kids into a sleep routine, in a routine period. And we talk about how important that is after a disaster, especially. And it's important for adults too. And I don't think about that enough.
And the thing to remember mostly of this is just really simple things, but we just forget. I mean, we're busy people. And so don't beat ourselves up about that. It's just, we probably already know it. It's not earth shattering information, but yes, we need routine too. And our bodies crave that routine, just like kids do. And so that's a really great reminder. And so it's good for the whole family. So if you want your kids to do better with a sleep routine, adults going to bed on time actually helps them do it too. Because if you're up late, they don't want to go to bed, and it just makes that issue. So it can help the whole family by making one person decide, hey, I really want to set some boundaries in this and do a better job.
Awesome. Any last minute questions for Renee before we close this up for the day? I don't see any in there. So, but if there are, we can respond to them later. Like I said,
absolutely. We'll be sure to put them in the chat. So if you see this on replay, put your comments in the chat and we'll get back to you. And thanks everybody for watching. Have a great Friday.
Good.